You are listening to ESG News and Views from the Conference Board.
Hi, I'm Paul Washington, Executive Director of the Conference Board's ESG Center. The Conference Board is the world's leading independent, nonpartisan, nonprofit think tank dedicated to serving business and society for over a century. At the ESG Center, we focus on delivering trusted insights in the areas of corporate governance, sustainability, and corporate citizenship. I'm really excited about today's episode of ESG News and Views because we're going to talk about the topic of health equity, what it means, why it's an issue for the business community, and what's the role that the board and C-suite can play in addressing this topic. You know, health equity is one of those issues we all became more aware of during the pandemic, but I'll tell you, it's got deeper roots. So we surveyed consumers about what they wanted companies to address in the area of sustainability. And quite strikingly, right after fair pay, regardless of background, was access to health care. So this is a big issue for consumers, for the general population, for employees. It's also a significant issue for some companies. We found in looking at 100 corporate citizenship reports from companies that health, at least broadly speaking, was one of their priorities. So that's 38% of companies. And we know that while health doesn't necessarily show up at the top of the list for CEOs, related issues like racial equality are at the top. So for example, racial equality is the number 3 social priority for US CEOs. So there seems to be a lot of interest in this issue, but the focus may not have actually, the spotlight may not have actually been shown enough on health equity and the opportunities for companies to play a role here. So I'm really excited about today's podcast because my guests are Dr. Jay Bhatt, Executive Director of the Deloitte Center for Health Solutions and the Deloitte Health Equity Institute, and Dr. William Payne, a founding member of the Black Directors Health Equity Agenda, a Chicago-based orthopedic surgeon and co-founder of the telehealth platform MyOwnDoctor. So Jay and William, thank you so much for joining today's podcast.
Honor to be with you.
Thanks.
Great. And so Jay, let me start with you, if I might. Health equity. Give people, if you could, a working definition of it.
Absolutely. Well, just a pleasure to be here with you and my colleague, Dr. Payne, and really excited about this discussion. Thank you so much for having it. Deloitte's definition of health equity is that it's about access and the fair and just opportunity for everyone to fulfill their human potential in all aspects of health and well-being, regardless of their circumstances and experiences. So we believe that everyone should have the opportunity to thrive, regardless of their race, ethnicity, gender identity, sexual orientation, disability status, geography, or other characteristics. We believe that addressing health equity is both a moral and business imperative, and that every company has a critical role to play in driving health equity as an outcome.
That's great. And William, do you have anything you'd want to add to your perspective on what health equity means? I mean, that was a pretty succinct and excellent definition, but anything you'd want to add?
Sure. I think that I agree with everything that he said, and I'm a more simplistic person. And so I think of it in this way. If you had 3 people who needed to cross the street to get better health, each of those people would be planning to go across the street in their own way. And the question is what's the best way to get them across the street? Until you know what they're about, you can't really help them. And I'll give you an example. So the first person is blind. Well, obviously, he needs different resources to cross the street than the second person who's deaf. He needs different resources, and the third person can't walk. And so health equity is about giving people the resources that they need to get to better health. And each individual and their personal circumstances helps to drive it. So that's kind of how I think of it in a very simplistic way, is how do we help people make the journey to better health, and what resources do we need to bring to bear to make that easy and succinct?
Dr. Payne, that's well said, and I love the simplicity of it. And I think putting in context is helpful. And it makes me think of an old adage: give a man a fish, feed him for a day. Teach a man to fish, feed him for a lifetime. But there's complexity to equity, and it's about the circumstances. And for example, why not teach women what if the pond is polluted? And what if the community is historically denied access to fishing equipment?
Correct.
Similar kind of metaphor.
Absolutely.
Yeah, it is. And, there's the parallel also with racial equity and racial equality. We've done a lot of work in this at the conference board, and sometimes people wonder what the difference is. Well, the ultimate outcome that you may be striving for is racial equality, which everyone can get behind. But to get there, you have to have racial equity. Those are the conditions necessary to provide that equal access, right? And so you have to meet people where they are in order to get them to where you want everyone to be. And I think the other thing that comes through in what both of you said is that, we often talk about economic opportunity and fairness and so forth, but goodness, isn't health just as important as it? We talk about educational opportunity and fairness. Well, isn't health just as important? So I think, let's get into this a little bit more, because I think this is a very ripe topic for discussion. And, it's one that sort of sits sometimes in the back of people's minds, but this podcast will help bring it to the forefront. So let's talk a little bit about the impact that the pandemic had on health equity. I mean, we know that Black people in the US died at 1.4 times the rate of white people. We know that those hardest hit economically around the world were also infected at a higher rate than in developed countries. So can you give a perspective, Jay, of what is the state of health equity in the United States today? How does it compare to the past? Is it worse than it was in the 1950s or 60s? And how does health equity in the US compare to other developed countries around the world?
So I would say that health inequities are America's chronic condition.
Mm-hmm.
We have had history walk alongside us, and we have a history that we have to recognize and understand in order to understand where we are with health equity today and how we think about health as a country. We're the only developed country in the world that doesn't have universal health coverage. We, think about if we look at what COVID did, it really laid bare the inequities that are in our country, and that it affected everyone in some way. So I think that's what illuminated it, even though we knew the data about health inequity well before that. And I think the murder of George Floyd led to a reckoning and an awakening of social unrest and the impact of racism and bias in our country. And I would say that when we look at health inequities, and I was saying that's a moral and economic imperative, it's not only the right thing to do, it's a smart thing to do. And in the US, our report that we released in June said that health inequities account for $320 billion today. And if we don't adopt a future of health vision that Deloitte has put forth, that's $1 trillion in 2040. That's 1,000 for every American today and 3,000 for every American in 2040. And if we look at life expectancy, we're approaching 1996 levels, yet spending $3 trillion more on healthcare. And it continues to be far higher in the United States than any other high-income countries. And that a Rwandan Black male has a better life expectancy than a Black male in our country. And so, we're also seeing the US have the highest rate of people with multiple chronic conditions, an obesity rate that's twice the OECD average. Americans see physicians less often than people in most other countries. And their screening rates for breast and colorectal cancer, vaccination for flu in the United States are among the highest, but COVID-19 vaccination trails in many nations. So it's interesting as we think about the context, we still have a lot of work to do ahead. And health equity isn't a side hustle. It has to be part of how we think about our quality work, our safety work, our operations, our financial strategies. It has to be part of everything we do in terms of the lens by which we see, healthcare delivery.
Great. That's really helpful. I like the notion that, this is a chronic condition, and many of us have these chronic conditions that you just sort of live with. That doesn't mean that's the smart thing to do. And you've nicely outlined the cost. And frankly, there's the irony with it, which is if you live in the right zip code and you have the right healthcare plan or the right income, and frankly, the right people, you can get the best healthcare in the world in the United States. and it is about 20% of our GDP is devoted to health, broadly speaking. So with all of that investment and with all of that excellence, this is a chronic condition that is frankly an embarrassment. So it is an embarrassment. But what is, why should business in particular, beyond the healthcare industry? But William, why should the business sector pay attention to health equity?
Well, I think it's fairly simple in the sense that a healthy workforce is a productive workforce. And so it's really about what can we do as employers to help our workforce be healthier, because it matters in terms of productivity, it matters in terms of absenteeism, it matters in terms of presentism, and it matters in terms of how they promote your brand, how they think about your organization. So it matters at a lot of different levels.
Mm-hmm.
And I think the thing that I would encourage business leaders to think about is that we're all interconnected. And the pandemic, sort of building on your last question, the pandemic sort of clearly defined how we're all interconnected, because if someone came down with COVID in an office and 40 other people got sick as a result of it, that interconnection is really very clear. And so having a healthy workforce matters for all of those reasons. Jay, do you have some other thoughts?
Yeah, Dr. Payne, I would say that you're spot on, is this notion of how we're all connected. And we're seeing other industries see the importance of health, right? This convergence across retail, technology, consumer service, manufacturing, where health is important. If you take care of employees, you're in the health business. If you've got employees where you have to think about their well-being, as William pointed out, there's clear health implications for the company, for the people that are in the company, and for their families, and the public. So, I would think about that in that context. That the other thing I would say is about how there are 4 domains of action. So we often refer to these domains of actions as things that leaders can do to improve equity across these 4 key domains. The first is simple: do right by our people. How are we being representatives, allies, and advocates within our own organizations to drive more equitable outcomes? The second domain involves examining the products and services we provide from an equity lens. Who you're designing for, the types of offerings you create either advance or diminish inequity, what are the intended or unintended outcomes? And then the other, I would say, the third domain is looking for community. How are we building and serving community? How are we connecting networks and resources to advance equity and better outcomes of the communities we are part of? And often employees of a business may live in that communities they serve. And lastly, how are we using the power and voice of your organization, both the person, the voice, to activate on equity, creating a collective coalition that is greater than an individual organization, and thinking about vendor supplier diversity and other issues in the ecosystem as well as policy.
Yeah, no, there's terrific points. And I just want to pick up on this notion of interconnectedness. Your employees are somebody else's customers. Your employees may be the folks who are working for one of your suppliers, right? And that just underscores that the interconnectedness, which we saw in the pandemic, which we saw when Southwest Airlines couldn't get people to the airports, when we've seen supply chains disrupted, right? I mean, this is something that, while it may be focused for companies on their own employees, it has a very powerful ripple effect on the economy. And just as every company today is sort of a data company, because we all have data, right, that we need to manage and that we monetize often, right? Every company is also a healthcare company in a powerful sense. So I think that's great. And then I think, Jay, your point about where the different places that business should think about this is completely consistent with report we put out recently, was the role of the CEO in driving ESG, including social issues. And we had suggested that if something is important to the company, It should play out in your marketplace, the products and goods you sell, and those you buy. It should play out in the workplace with your operations and your workforce, and it should play out in the public space, which kind of captures your last two areas, which is in your community relations. It's in your government lobbying, right? And it's also in your communication. So I think there are a lot of parallels here. So that's great for, some of what the business community can do. But I'm really interested here in William as well, in like, what's the intersection of government and business here, right? Because it seems like with the fact that we don't have universal health care is a public policy issue. And we, as the conference board, don't take a stand on that, right? But that's a public policy issue. So what's the role of government here and the private sector? How can they work harmoniously to address health equity?
Well, I would say this. I think the role of government and the private sector is one that's collaborative. And I would say that government is ultimately responsible for the health and well-being of their citizens, both at the federal, state, and local levels. And and businesses can impact that at all of those levels. And one of the ways that they can do it is by being aware of the issues that affect their employees. And I'll just use housing as one example.
Mm-hmm.
Oftentimes, there are initiatives that are put forward that the business community doesn't rally behind, and it costs them nothing to do so. And they could lend their public voice to the issues that matter to their constituents and their employees and their customers. And that's a simple way for them to interact with one another.
Mm-hmm.
I think the public health infrastructure that we've witnessed during COVID made it clear that it's important that government continue to make those investments to keep us all safe and abreast of issues such as a pandemic. And I think ultimately, when you look at unmet needs, government has a role in making sure that people have unmet needs. 65% of employees have at least one unmet basic need. And so government and the private sector have to work hand in hand to make sure that they provide an adequate safety net for folks in general.
Yeah, those are really important points. And I'd also underscore that for companies, when you're thinking about your lobbying agenda, right, your public advocacy agenda, the areas that bridge the red-blue divide in our country are those relating to bread and butter economic and health access issues, right? Those are ones where you stick your neck out and you may not get it chopped off, and in fact you may may enhance your reputation for addressing those very basic needs that you're talking about here. So I think more companies can be alert to those opportunities to weigh in and frankly, as part of multi-industry coalitions. So you don't have to put your neck out on your own, but as part of multi-industry coalitions, getting behind issues such as our basic healthcare infrastructure and improving it. So that's great background. Now I also want to tackle, the role of the board in this area. I was at a dinner last night with a bunch of corporate directors, and the topic of health equity came up. Serendipitously, right? And it was interesting because for the individuals in the room, health equity, they recognized it as a big issue. But when we talked about whether it was on the board agenda, it wasn't. So we know that at the outset of the pandemic, employee health and safety was the number one issue for American boards, ahead of everything else other than liquidity, which was having enough money to stay in business. But the next most important thing in May of 2020 was employee health and safety. So it's possible to have boards focus on this area, but obviously attention has faded as we've moved beyond the high point of the crisis. So on an ongoing basis, what role do boards play here? William, do you want to take that one?
Yeah, sure. I think boards play a very important role in the sense that they are governance. And in many ways, they set the agenda. They ask the appropriate questions of the leadership team, the management team, and operational teams to understand it. And I would say that one area we haven't really mentioned specifically is health insurance.
Mm-hmm. Yeah.
The single biggest decision that a company makes is what kind of health insurance they're going to provide for their employees. And that insurance can be very equitable or not very equitable. And I think that when you start to consider that, that's a question that they should ask. Are we providing people with the resources to live and be their healthiest? Decisions around EAP is another example,
Hmm.
you know, and what access they have available. And does the provider network look like the community that they're serving, their employees?
Yeah.
So there's many different questions that could be asked at the governance level. And then how does health equity get built into the overall strategy across the organization? Because I think it should be something that's part of the core fabric. And I think boards can set that agenda and ask those questions. Jay, do you have other things you'd like to add?
Yeah, I think William, you have made some great comments. Well said, and I will come back to it. But I think some of the comments you made around public-private partnership really important, and just we should talk about both direct and indirect ROI. And I think that health equity will change the basis of competition for companies. And when it comes to governance, Deloitte and the American Heart Association and the Harvard Chan School of Public Health are co-chairs of the World Economics Forum's Global Health Equity Network, which is a mandate to shape a healthier and more inclusive world by convening executive leaders across sectors and geographies that commit to prioritizing action towards health equity, and certainly ESG as well. And what we had happen at the recent Davos meeting is the launch of the Global Health Equity Network's Zero Health Gaps Pledge, committing companies to incorporate health equity into core strategies, operations, and practices to advance health equity. And governance was a big part of it. Creating a governance structure and having the governance be involved in accountability, success of the strategies, and really being a strategic partner with the C-suite leadership in activating around health equity. And that, the board can really help around a shared understanding with an organization as it relates to health equity. And even, organizations can look at their board composition and compare it to the geography and the populations they serve and say, are we representing, the community and the people we serve? And that exercise, just to actually look at it, has been really powerful. And then I think training that governance can do, because everyone's at different places, in their journey. So William, I've seen examples where, for years that organizations have not had women on their board or people of color that reflect the communities they're serving. But when they look at it, they see that, but they also see skills and perspectives and backgrounds and experiences that can be brought to the table in the conversation, which I think can lead to better discussion, decisions, and outcomes as well.
So this is great. And, some people who are listening may say, okay, this is great, but how do I actually fit this in with the board's discussion? And there actually is a very logical place for this to fit, which is, you have your business strategy, right? And then that tells you where you want your business go from now to 5 years from now. You should also have a workforce strategy that accompanies it, right? So what workforce do you need in 5 years, and how do you get there? Well, a core part of that workforce strategy is a healthy workforce, right? And one where there are not health inequities, certainly not to the extent we have now. So part of that is then, as you're looking as a board, okay, what's our healthcare coverage? But I'd also add to that, what's the usage of that healthcare, right? Like, are we providing people with the time off to be able to go to the doctor? Are there other benefits or other things we need to do to make sure people can get across the street, right, William? And or a few miles away, right, in a busy day, and then are the people actually using it? So I think incorporating health equity into your broader workforce strategy, some people call it a human capital management strategy, is a place where boards could very naturally incorporate this without, as part of a broader picture.
I would just add that part of the challenge and part of the opportunity is to use language that's more inclusive and build that into your workforce engagement propositions.
Hmm.
And I think that's something that any organization can do and start with if they want to just put their toe in the water, to be more inclusive, to get the issues that various subgroups may have
Yep.
out on the table so that their needs can be met.
I think that's a great point, because one of the things we've learned in this whole area, whether it's sustainability, diversity, equity, inclusion, is this has to be a two-way dialogue. The folks in management, the folks in HR don't have all the answers. So this has to involve a lot of listening. So before you design your healthcare program, before you design what you're doing for your employee population, listen to them.
Yeah, Paul, William makes such a wonderful point about language inclusion. And I think often literacy is not talked about as well, but how you shape the language, at what level it's at, the support you give employees in that process, and the training you give the managers, leaders. And that's just one part of a playbook that we've been fortunate to work with William and his colleagues at the Black Directors Health Equity Agenda to develop, called Prioritizing Health Equity in the Boardroom Playbook, to outline levers board members can pull to move the needle on advancing health equity in their governance roles. So we know that this could be a new or even difficult topic for some organizations. And so this playbook really aims to help those in governance on their journey. And, we look feature strategic questions board members can ask at the organization level and across those domains of action I mentioned earlier. And then there's some case studies presenting the opportunity to learn from other leaders' approaches and experiences. But William, I found that that's been really helpful.
Yeah, and I want to get into the Black Directors Health Equity Agenda and the playbook in just now, because I think that's a great segue to it. But by the way, the other thing, but picking up on the literacy point before we quite get there, one of the things that companies can do with their employees is actually help improve their literacy in discussing things with their doctor, right? We find that a lot of people, they get in there with their doctor and they don't know how to talk to a doctor. They get shy about it. And that lack of communication can result in a lot of bad health outcomes. So this is just like companies are paying attention to the financial literacy of their employees. They can also pay attention to the health literacy of their employees as well, and make a meaningful difference in their lives. But William, can you tell us about the Black Directors Health Equity Agenda, its mission, and what you're trying to achieve?
Sure. So the Black Directors Health Equity Agenda is really comprised of a group of board of directors, industry partners, and other leaders who have come together for the purpose of addressing health inequities in the Black community specifically. And the goal is to improve the health of Black folks who get the most of the worst and the least of the best.
Mm-hmm.
And so it's a coalition that does convenings, brings subject matter experts, uh, consulting partners like Deloitte to the table to help us solve these complex problems that have been in existence for decades
Mm-hmm.
and have been unsuccessfully managed. And so we're really seeking to make a difference. And in making a difference for Black folks, it should make a difference for everyone, because all boats will rise. Now, we're all in different boats, right? Some are sailboats, some are powerboats, some are dinghies, but all boats will rise as we make this difference. And really, that's the goal, is to improve the health of everyone in the end.
Great, really helpful. And so obviously, there's been the collaboration with Deloitte on the Health Equity Institute, and then your playbook that you've developed. Jay, you started to talk a little bit about the playbook, but what does this playbook look like? What does it cover? If you give folks a sense of, is this a PowerPoint deck? Like, what is the playbook? What does it cover?
Yes, so the playbook helps set some context and background around what health equity means, and then domains in which board members can act on to move the needle on advancing health equity in their roles. And so it'll cover the understanding of health equity, the role of board directors in health equity, how board directors are positioned to make an impact, talks about the business imperative for investing in health equity and how it applies to board directors and the type of organizations they serve, Then we offer strategic questions that board members can ask in their roles, and offer a perspective on community and ecosystem, as well as organizational levers to engage when having these conversations at the board level. And then Playbook provides some case studies, really helping the board members understand what are some ways that others have activated health equity, and so they can build on them and accelerate their own progress in the organizations. And we've built on that to further support activating health equity in the boardroom. We've developed with the Black Directors Health Equity Agenda, the board ESG guide, really to fuse the health equity lens into their organization's ESG strategy. So again, foundational knowledge about ESG, framework definitions, and then outlining how ESG is linked to health equity. And then sitting in governance, the role that board members have on making positive impact decisions on environmental and social actions that solve for health inequities. Because we know that place-based inequities are a component that are important to address.
Oh, absolutely.
And so then there's business case studies, and actionable next steps.
Okay, that sounds really valuable. William, so as you've rolled this out in boardrooms, what's been the reaction from directors when they are exposed to this playbook?
The reaction has been one that's been very positive. I think directors were looking for ways to introduce the subject, right? I think this gives them a roadmap to ask key questions and to have crucial conversations both in the boardroom and outside of the boardroom. I think it creates an excellent framework for understanding the data that's necessary to be collected and analyzed. And I think it gives a lot of touch points for people to begin the process of understanding health equity and how they might participate in a meaningful way and make a difference for their workforce and the broader community.
Great. Let me ask you this, and I got just a couple more questions. One is, so let's say a board's seen the playbook and they get started on it. What are sort of realistic goals to set along the way for your company in health equity? I'm sure it depends on the circumstances of the company, but what's sort of the maturity journey in this area that directors should aspire to? I'm just in a realistic way, right? I'm just kind of what's the first stage? What's the second stage? What does a mature and robust effort relating to health equity look like? And Jay or William, whoever wants to tackle this one first.
So I'll start, and would love William's thoughts as well. I think, one, you got to start with a measurable and credible strategy on health equity. And then that strategy being applied through the 4 domains of action I talked about earlier, about organization, their offerings, community, and ecosystem. And then understanding where you're going to start. So I think one of the things that may not often happen consistently is interrogating your own data. What are the questions that you need to ask to understand the state of play in your organization and in your community as it relates to health equity? So, we have a pulse check, which helps leaders and teams activate those efforts by assessing current state, future aspirations, priority action, and accountability. And that we've found to be helpful.
That really is helpful too, because we find this with boards all the time, where they say, okay, what's our ESG strategy? How do we get started? Well, in many cases, it's looking like any strategic question. It's where are you today? Then where do you want to go? And how do you get there? And a lot of companies have jumped just to where do we go, right? Without thinking about where they are today, because looking where you are today can give you a good sense of what you're building from. Well, William, your thoughts. So you've got your strategy, you've done this assessment of data. So then what does it look like after that? Like, should people is there some nirvana of 100% health equity you should look for? Is it, anyway, just where might you go?
I would say it like this, and I would break it down in the following way. I think the goal is to really figure out for my workforce and my community if they have unmet needs, can I meet more of those needs?
Okay.
And do some sort of assessment to say that I'm actually delivering on that promise. And so, and I'm going back to the health insurance.
Hmm.
Do people utilize it? Do they understand it? Do they know how to access it? Things of that nature. And then from a strategy standpoint, I'm just going to give a small example. Selena Gomez came out with a cosmetic line. Um, and part of her approach to her cosmetic line was to basically say, first of all, you're beautiful, and cosmetics are just an accessory to your natural beauty.
Hmm.
The second thing she did was she made her cosmetics that they could be applied by people with arthritis. So
Right.
that was an inclusive example. And then the third thing she did was she's donating 1% of the proceeds for mental health. And so
Hmm.
those are some very concrete examples of how you can sort of build into a health equity strategy into, as Jay so eloquently described, your service offerings and products, as well as for your community and the people that you serve. And so I would offer that as an example.
No, that's really, really helpful. So let me wrap up with this question. In today's world, a lot of companies are looking at sustainability, whether in environmental arena or in the social arena, as a competitively distinguishing factor, right? So Selena Gomez's cosmetics, our line, are stand out because of what she's doing in that area. At the same time, companies recognize that they have to work in partnerships with other firms at their same level and in their supply chain up and down, to have impact, right? Because time and again, companies have tended to go on their own. We find that 85 to 90% of companies' responses to natural disasters, to the death of George Floyd, those commitments that they make are made in isolation. Now, they then spend the money through nonprofits and so forth, but they're making these commitments in sort of splendid isolation, right? So, in this area, what do you see, William? Like, how can companies effectively collaborate in the arena of health equity, maybe going beyond just lobbying government action? Are there other areas where companies can get together and maybe share their data on health equity, like different companies in Minneapolis or in some center? Like, is there something that companies can do with each other, without surrendering their competitive advantage, without otherwise violating the antitrust laws? Anything that companies can do together that you would suggest to address health inequity?
Yeah, I would say that there's plenty that they can do together. And it just starts with a conversation and a willingness to do that.
Mm-hmm.
I think the first point around sharing data, I think you can share the data in an anonymized way
Yep.
that allows um, folks to understand what's really happening at the most basic level, and then to come up with combined strategies that are effective. And I'll just use CVS by way of example.
Mm-hmm.
Um, they're investing $180 million into affordable housing in many of the cities that they're in, because they've recognized that this is a problem for those who are vulnerable.
Mm-hmm.
And so that's being done in collaboration with developers and city and local governments and a variety of things. And imagine if other companies were to sort of add on to and amplify those efforts, you could start to make an impact in any one given city. And so I think part of it is sharing what efforts people are doing. There's no catalog between companies that says, "Hey, we're doing this and you're doing that," and there's synergies here. But I think all of the information sharing, convenings, like the BDHEA
Mm-hmm.
offers, for example, are ways for folks to get together and share their knowledge and ideas and best practices.
Terrific. Jay, anything you'd like to add to that on the collaboration side?
Well, we're just so grateful to be part of the Black Directors Health Equity Agenda community and to collaborate in the spaces that William talked about, because I do think that that's where the magic happens, in these coalitions where you can bring the strengths of your experiences and assets and relationships to the fore to advance health equity. One of the things, to the point William was making about data, is that Deloitte took an important step in our commitment to acknowledge and act by sharing data on our current state and identifying focus areas and goals as related to diversity, equity, and inclusion. And so we released our inaugural Diversity, Equity, Inclusion, Transparency report in January of 2021, and then released the second edition in 2022. And that allows us to flip orthodoxies, have the data to take action and be accountable. And through intentional actions, big and small, we know that it's important to show that our colleagues and our employees belong, that they're valued and they're celebrated. And that can be a force for progress. I would say that the other thing that we do is participate in a number of different roundtables. One is the American Heart Association CEO Roundtable, and we lead by example there in creating systemic change for employees together with others and learn from each other and have collective action in regional communities. We also, for example, are supporting and an active participant in the Greater Washington Partnership, Washington, D.C., Maryland, Virginia, in their effort for inclusive prosperity. And that is looking at policy systems and environmental changes together where you can bring the strengths of organizations so that you build on each other's assets and opportunities for collective progress.
That's real. Thank you for those very specific examples too, to both of you for that. And I mean, I think the pandemic shone the light on health inequity in this country, and I think the discussion today has shed some light on what companies at the top of the house can do about it. I think you've really highlighted the intersection of the health equity with other issues at a company, whether it's workforce well-being, generally speaking, racial equality. There's obviously the intersection between the environment and social issues that come to a head when you're looking at health equity. So a lot of intersections there, and I think this ending discussion about the partnership is also really powerful because this is such a chronic issue, as you pointed out, that there are actions that each company can take on its own, and the board can make sure it's taking on its own. But the board should also be asking, what are the partnerships that we're engaging in to address this more broadly beyond our four walls? That's a key question for boards to ask. So, Jay and William, thank you so much for this terrific discussion, for your time today. Thank you all for listening. To learn more about the resources and reports mentioned in today's podcast, you can find all the related links wherever you listen to your podcasts and also on the conference board website, tcb.org. So, William and Jay, thank you again for being so generous with your time and your insights.
Thank you so much for having us.
This has been ESG News and Views from the Conference Board.